Cerebral palsy, causes, symptoms, and therapeutic approaches. Title: Cerebral palsy, causes, symptoms, and therapeutic approaches. Introduction. Cerebral palsy, CP, is a group of lifelong movement disorders that affect muscle coordination and body movement. It is caused by damage to the developing brain, usually before or shortly after birth. CP affects individuals in different ways, ranging from mild to severe impairments. This article aims to delve into the causes, symptoms, and therapeutic approaches associated with cerebral palsy. Causes. The exact cause of cerebral palsy remains unknown in most cases. However, various risk factors have been identified that contribute to the development of the condition. These risk factors include premature birth, low birth weight, infections during pregnancy, maternal health issues, genetic abnormalities, and birth complications. Brain damage may also occur during childbirth due to insufficient oxygen supply to the baby/'s brain or physical trauma during a difficult delivery. Symptoms. The symptoms and severity of cerebral palsy can vary significantly from person to person. Common symptoms include difficulties with muscle control and coordination, abnormal reflexes, muscle stiffness, spasms, or tremors. Some individuals may experience challenges in speech, swallowing, or hearing. Other common symptoms include difficulties with balance, muscle weakness, and impaired fine motor. Skills. Cerebral palsy can also be associated with cognitive impairments, learning disabilities, and seizures. The type of cerebral palsy a person has can be classified into four main types: spastic, dyschem, tic, ataxic, and mixed. Therapeutic approaches. It is important to note that there is no cure for cerebral palsy, but these interventions can make a significant difference. 1. Physical therapy. Physical therapy plays a crucial role in managing cerebral palsy. It focuses on improving muscle strength, flexibility, coordination, and mobility. Physical therapists use techniques such as stretching exercises, gait training, and assistive devices to help individuals maximize their physical potential. 2. Occupational therapy. Occupational therapy aims to enhance a person's ability to perform daily activities. Therapists work on developing fine motor skills, coordination, and sensory integration. ION. They also suggest modifications to the home and school environment for better accessibility and independence. 3. Speech and language therapy. Cerebral palsy can affect communication skills, making speech and language therapy an integral part of treatment. Speech therapists help individuals with CP improve articulation, voice control, swallowing, and understanding language. Alternative communication methods like sign language or assistive communication devices may be recommended if necessary. 4. Medications. Medications can be prescribed to manage various symptoms of cerebral palsy. Muscle relaxants, anticonvulsants, and botulinum toxin (Botox) injections may be used to control muscle stiffness, spasms, and seizures. It is important to consult with a healthcare professional to determine the most suitable medications for an individual with cerebral palsy. 5. These devices are customized to meet each person's specific needs and may be recommended by healthcare professionals. 6. Surgical interventions. In some cases, surgical interventions may be necessary to improve functional abilities or address specific complications associated with cerebral palsy. These interventions include orthopedic surgeries to correct skeletal abnormalities, muscle releases to reduce spasticity, or selective dorsal rhizotomy to reduce muscle stiffness. References. 1. Dorsey, E. R. Constantinescu, R. Thompson, J. P. Biglin, K. M. Holloway, R. G. Kieburtz, K. and Amp, Dodenhoff, K. 2007. Projected number of people with Parkinson disease in the most populous nations, 2005 through 2030. Neurology, 68.5, 384 to 386. 2. Tanner, C. M. Goldman, S. M. and Amp, Aston, D. A. 2006. Smoking in Parkinson/is disease, a risk factor for poor outcome. Movement disorders, 21-2, 221 to 222. 3. Pfeiffer, R. F. 2016. Non-motor symptoms in Parkinson/is disease. Parkinsonism and AMP, related disorders, 22, S119 S122. 4. Chaudhary, K. R. Martinez Martin, P. Brown, R. G. Setti, K. Stocky, F. Odin, P. and Amp, Lyons, K. E. 2007. The metric properties of a novel non-motor symptom scale for Parkinson/and hash. 039, S disease, results from an international pilot study. Movement disorders, 2213, 1901 to 1911. 5. Prinksheim, T. Yetta, N. Fralges, A. and Amp, Steves, T. D. 2014. The prevalence of Parkinson/is disease, a systematic review and meta-analysis. Movement disorders, 2913, 1583 to 1590. Note, the word count of the existing content is 800 words. To reach 1,497 words, an additional 697 words need to be added. Treatment and management. In addition to therapeutic approaches, individuals with cerebral palsy can benefit from other treatments and management strategies that aim to improve their overall well-being and quality of life. 1. Adaptive equipment. Adaptive equipment refers to devices or tools that help individuals with cerebral palsy perform tasks and activities independently. Examples include modified utensils for eating, specialized keyboards, and computer software with assistive features. These adaptations can enhance accessibility and promote independence in various daily activities. 2. Nutritional support. Proper nutrition is crucial for individuals with cerebral palsy to support their growth, development, and overall health. A balanced diet should be maintained to ensure adequate intake of essential nutrients. In some cases, a feeding tube may be necessary if swallowing difficulties persist, ensuring nutritional needs are met. 3. Emotional and psychological support. Living with cerebral palsy can be emotionally challenging for individuals and their families. It is important to provide emotional support and counseling services to address any psychological distress or mental health issues that may arise. Support groups and therapy sessions can also offer a valuable platform for individuals and families to connect with others facing similar challenges. 4. Educational interventions. Individuals with cerebral palsy may require specialized educational interventions tailored to their unique needs. Individualized education programs, IEPs, can be developed to provide appropriate academic accommodations, modifications, and support services. This ensures the individual receives an education that maximizes their learning potential. 5. Assistive technology. Assistive technology encompasses a wide range of devices and software that can assist individuals with cerebral palsy in various aspects of their lives. Advances in technology. Why continue to expand the possibilities for individuals with cerebral palsy to participate fully in their communities and pursue their goals? 6. Early intervention services. Early intervention programs play a crucial role in supporting infants and young children at risk of or diagnosed with cerebral palsy. These programs offer a range of Services such as physical therapy, speech therapy, assistive technology, and parental support. Early intervention aims to promote optimal development and mitigate the impact of cerebral palsy on a chi. LD/'s overall growth and well-being. 7. Coordinated care. Caring for individuals with cerebral palsy often requires a team approach involving various healthcare professionals, including doctors, therapists, social workers, and educators. Coordinated care ensures that individuals receive comprehensive and integrated services that address their medical, therapeutic, educational, and psychosocial needs. 8. These organizations provide valuable resources, information, and support to individuals and families affected by cerebral palsy. Genetic factors. Although the exact cause of cerebral palsy is often unknown, genetic factors can play a role in its development. Certain genetic abnormalities and inherited conditions increase the risk of cerebral palsy. These include chromosomal abnormalities such as Down syndrome, genetic mutations, and metabolic disorders. Genetic testing may be recommended in cases where there is a suspected genetic component. To better understand the underlying cause and guide treatment decisions.